Could eating at restaurants increase your chances of getting COVID-19? That's what the latest study by the CDC and Vanderbilt University Medical Center seems to suggest after comparing hundreds of patients who tested for the virus.
News Channel 5's Matthew Torres joins us downtown. And Matthew, you spoke with some folks today. Not everyone's a fan of this study.
That's right. Doctors say it is important to identify high-risk areas and reduce exposure, but you now have the National Restaurant Association blasting the study, saying it contains flaws and that it found no systemic spread of the virus from restaurants that have closely followed safety guidelines. Jim Hagee is finally seeing customers back at his restaurant, Chef's Market, but despite his strict safety protocols in place, it may not be enough.
After so many sort of gut punches since March, it's just another one.
A new study by the CDC and Vanderbilt University Medical Center suggests dining at restaurants may increase your chances of getting COVID-19 just as much as bars. Local restaurant owners are taken aback.
To say that is really thoughtless. And is really targeting one set of business and one industry unfairly.
I do understand that, and I understand why. And we're not saying restaurants are bad places.
Dr. Wesley Self says the goal of the study was to analyze different places of exposure and found restaurants to be a common thread. The study surveyed hundreds of patients who tested positive and negative for COVID-19 in 11 hospitals across the country in July.
The people who were symptomatic and tested positive for COVID were much more likely to report that they've gone to dine in restaurants over the previous 2 weeks compared to those who tested negative.
He encourages takeout or delivery, avoid sharing utensils or plates, staying socially distanced, and wearing masks when not eating or drinking.
We think it's the proximity without masks, and in particular in an activity like eating or drinking, that could spread the virus from one person to another.
Owners like Hagee say they will continue their plan. He's confident customers will stay safe.
I think that the people that are coming in here to eat, they're dependent on coming here, and they enjoy it. I don't think it will deter them.
Now, the study does not include if the patient was eating outdoors or inside. The report says exposure in restaurants has been linked to air circulation. So depending on the intensity, even the direction, that can affect the transmission of this virus, even though there are safety protocols in place. Reporting live in Nashville, Matthew Torres, News Channel 5.